What if I told you that improper waste disposal is creating disease hotspots in neighborhoods worldwide, and that simple collection systems could prevent millions of infections? In low income countries, 60% of waste goes uncollected. That's not just an inconvenience, it's a public health catastrophe unfolding in slow motion, breeding grounds for diseases multiplying with every passing day. I'm Dr. Anthony Iyore Anaweokhai, and on Global Health Decoded, we translate complex public health research into evidence you can always use. Quick reminder, this is educational content based on peer reviewed research from the World Bank, the WHO, and global health institutions. This is not personal medical advice. For health concerns, consult qualified healthcare professionals in your area. It's important to note that waste management quality and disease risk vary significantly by location and local infrastructure. Check your local public health resources for your area specific conditions and guidelines. The scope of the problem, the global infrastructure failure. Now we've examined air pollution, water contamination, and the absence of green spaces. Today we're investigating waste. What happens when cities can't manage the garbage their populations produce? Now, according to World Bank data published in 2025, globally 93% of waste in low income countries is dumped in uncontrolled landfills or openly burned. In low income urban areas specifically, only 48% of waste gets collected at all. That means 52%, more than half, accumulates in streets, in vacant lots, in waterways, and in neighborhoods. Now, this isn't about aesthetics or property values, though those matter. This is about disease transmission. Uncollected waste creates conditions where pathogens, vectors, and vulnerable human populations intersect with devastating consequences. The pattern is predictable. Rapid urbanization in low and middle income countries outpaces infrastructural development. Populations grow, the consumption increases, waste generation accelerates. Our collection systems, treatment facilities, and disposal sites don't keep pace. Now, the gap between waste produced and waste managed widens year after year. And it's not distributed randomly. Informal settlements, low income neighborhoods, and marginalized communities bear disproportionate burden. These are the areas where collection services don't reach, where residents lack political will to demand services, where waste accumulates unchecked. Now, we begin with a quote. Understanding the world includes seeing what we'd rather ignore. Because that's where change begins. In the problems we've learned not to see. Now, but to understand why uncollected waste is so dangerous, we need to examine the specific disease transmission pathways it creates. Let me show you exactly how waste becomes disease. Uncollected waste attracts vectors. Those are organisms that transmit pathogens from one host to another. The three primary categories are mosquitoes, rodents, and flies. Mosquitoes come in through discarded containers, bottles, cans, tires, plastic containers, collected rainwater, creating perfect breeding sites for mosquitoes. Aedes aegypti mosquitoes, which transmit dengue fever, Zika virus, chikungunya, and yellow fever, breed prolifically in these artificial containers in urban waste. A single discarded tire filled with water can produce hundreds of mosquitoes weekly. Research shows direct correlation between uncollected waste density and mosquito-borne disease transmission rate in urban areas. When waste removal improves, disease incidence drops measurably. Rodents. Organic waste provides food sources that sustain rats and mouse populations. These rodents carry leptospirosis, hantavirus, salmonella, and serve as hosts for plague-carrying fleas. In areas with open waste dumps, rodent populations explode, bringing them into closer contact with human populations. Now, flies. Flies breeding in organic wasteland on human food and surfaces, mechanically transferring pathogens. Houseflies and blowflies are attracted to decomposing organic waste. They breathe there, they travel to human food sources, spreading enteric pathogens that cause diarrheal diseases. The mechanism is pretty straightforward. Waste creates habitat and food for vectors. Vector populations increase. Human vector contact intensifies. Pathogens transmission accelerates. Remove the waste and you interrupt the entire chain. But vectors aren't the only problem. The waste itself becomes a source of pathogens. Decomposing organic waste, food scraps, human waste in areas without sanitation, animal carcasses, creates ideal conditions for microbial pathogen growth. As organic material decomposes, bacterial populations multiply exponentially. Warm temperatures, moisture, abundant nutrients create what microbiologists call enrichment culture conditions. Environments optimized for bacterial growth. Pathogens include E. coli, Salmonella, Shigella, and Vibrio species thrive in decomposing waste. Now, these trans pathogens then contaminate surrounding environments through multiple pathways. Rain washes pathogens from waste into soil and water sources. Wind carries dried particles containing bacteria. Vectors land on waste, pick up pathogens on their body, and transfer them elsewhere. In areas where waste accumulates near water sources, which is common in informal settlements without designated disposal sites, contamination of drinking water becomes direct and severe. The fecal-oral disease transmission we discussed in the water episode intensifies dramatically when waste management fails. Now, education is the art of understanding the world, of improving it, and of living well within it. And waste management represents exactly that art in practice. Understanding decomposition and pathogen growth enables us to design systems that prevent waste. Managing waste properly is applied microbiology translated into public health protection. Leachate, that liquid that forms as waste breaks down, percolates through soil, carrying pathogens, carrying heavy metals, and carrying water contaminants into groundwater. In areas where people rely on wells for drinking water, these contamination paths create direct exposure routes. And the inequality in exposure to these hazards is stark and measurable. World Bank data shows that in low-income countries, 93% of waste is dumped or burned open. But within countries, within cities, exposure is stratified by income and political power. Informal settlements typically have no formal waste collection. Residents must dispose of waste themselves, often dumping it into nearby areas, creating concentrated waste zones adjacent to housing. Children play near the sites. Food vendors operate nearby. Daily life occurs in proximity to decomposing waste, vector breeding grounds, and pathogen reservoirs. Even where collection services exist, frequency and reliability differ by neighborhood. Wealthier areas often receive daily or multiple times weekly collection. Poorer areas might have weekly service or less. During service gaps, waste accumulates, problems compound. Open dumping creates environmental justice issues visible even from space. Satellite imagery shows how waste concentrates in specific neighborhoods, almost always low-income areas which marginalize populations. These communities experience elevated rates of respiratory infections from burning waste, from diarrheal diseases, from contaminated water, vector-borne diseases from mosquito and rodent populations, and skin infections from direct waste contact. The children growing up in these conditions face cumulative exposure that affect development, affect educational attainment, and affect lifetime health trajectories. Repeated infections cause malnutrition, cause missed school days, and cause long-term health complications. I'll give you another quote. Where you are born shouldn't determine whether you grew up surrounded by disease vectors, but in today's cities, geography often becomes destiny. That's not inevitable. It's a failure of systems we can redesign. And here's the critical point. This is entirely preventable with known, affordable interventions. So what actually works to solve this crisis? The good news is we know how to manage waste in ways that prevent disease. Multiple cities have implemented successful interventions with documented health improvements. Regular collection systems. Now, when waste collection frequency increases, disease incidence decreases measurably. Studies from cities that expanded collection services to previously underserved areas show reductions in diarrhea disease, reductions in respiratory infections, and reductions in vector-borne disease within months. Community-based collection programs. In areas where municipal services can't reach or can't afford full coverage, community-organized collection cooperatives have succeeded. Residents contribute small fees, waste workers receive fair wages, and neighbors achieve consistent collection. These programs work particularly well when integrated with recycling income, creating economic sustainability. What about sanitary landfills versus open dumping? Now, properly engineered landfills with compaction, daily cover, leachate collection, methane capture prevents disease transmission pathways. The cost difference between sanitary landfills and open dumps is modest, but the health outcomes differ dramatically. Waste separation and recycling programs. Separating organic waste for composting reduces volume requiring disposal, thus creating useful compost for urban agriculture and decreases pathogen reservoirs. So recycling programs remove containers that would otherwise have become mosquito breeding sites. In fact, the World Bank estimates that achieving universal waste collection in low-income countries would require approximately $5.5 per capita annually. For context, the healthcare cost of treating diseases linked to inadequate waste management far exceed that prevention investment. What prevents implementation isn't technical knowledge or even primarily cost. It's political will, it's governance capacity, it's prioritization. Now, cities that treat waste management as public health infrastructure, not just as sanitation aesthetics, achieve dramatically better outcomes. Drop a comment. Does your city have reliable waste collection? If you've traveled to places with different waste management systems, what difference did you notice in neighborhood environments? 3 key takeaways from today. First, in low-income countries, 60% of urban waste goes uncollected, creating disease transmission pathways through vector breeding grounds, pathogen multiplication, and environmental contamination. This isn't just inconvenient, it's deadly, particularly for children. Second, uncollected waste creates conditions for mosquito-borne diseases, rodent-transmitted infections, and waterborne pathogens. The disease burden falls disproportionately on informal settlements and low-income neighborhoods lacking collection services. Third, solutions exist and have been proven effective. Regular collection systems, community-based programs, sanitary landfills, and waste separation all reduce transmission. The barrier isn't technical knowledge, but political prioritization and investment. If you think garbage is dangerous, wait until you hear about what's literally cooking poor neighborhoods at temperatures 10 degrees higher than wealthy areas. In the next episode, we'll discuss urban heat islands, why poor neighborhoods are 10 degrees Celsius hotter. Did you find it valuable? Share it with urban planners, policymakers, or anyone living in a city, which is most of us. Subscribe for the next episode on urban heat islands. Until then, stay informed.